Hi, Lisa. Nick here. Thank you for joining me today. If you could please just go ahead and introduce yourself and tell us about your exciting work that you're working on nowadays.
Thank you. So, my name is Lisa King, and I'm a clinical psychologist in the Department of Clinical and Health Psychology here in PHHP.
Hmm.
Uh, my work is mostly clinical. I do teach and supervise students in training,
Okay.
etc. We have a doctorate program in our department that trains clinical psychologists.
Gotcha.
So I have a team of counselors that work for me, mental health counselors and social workers at the master's level.
Hmm.
And our task is to service students, faculty, and the general public for mental health needs.
Sure.
So
Okay.
a little bit in general, that's what I do. Um, lately,
Okay.
more lately with the pandemic, when
Hmm.
everything hit, I had one patient that I had been already doing telehealth with.
Ah, okay.
So I was familiar with the system.
Hmm.
So when we learned that things were looking pretty bad pretty quickly,
Sure.
I was able to get my team up and onto telehealth and all of our patients into my chart, being able to access telehealth pretty quickly.
Gotcha. Okay. So we're recording this on May 8th, 2020. So we've all been in social distancing situations for about 6 weeks now. So
Mhm.
if you had experience with telehealth and telemedicine, um, is that format a part of the curriculum that students learn, or did they have to learn a whole new skill set?
Our entire department had to learn
Oh,
a whole new
wow.
skill set
Okay.
really quickly.
I see.
I was the only one. I think Dr. Fideli, I think, had started doing he's in the child area, had started doing some telehealth very near to when this all happened.
Hmm.
I had been doing telehealth with just the one patient for about a year. But the
Okay.
students, before the pandemic, most insurance companies don't pay for telehealth for mental health.
Oh, okay.
And with physicians, my understanding is that prior to the current situation, they paid a reduced rate. I don't know that for
I see.
factual, but that's my understanding is that it was a lower rate.
Hmm.
So we
Uh,
weren't offering telehealth
What's
then.
the rationale just to ask for
I have
insurance
no idea.
companies to pay? Because you still have the same clinical experience. We have a glass screen in front of each other instead.
Right.
So, is there any research that the insurance companies are citing to show that a reduced rate because of less effectiveness or something like that?
Well, there are some limitations. I mean,
Sure. Yeah.
we have a screen in front of us, but
Hmm.
in some ways, I have less control over what's happening in the room, right? I have less
Oh,
control
exactly.
over
Yeah.
the session. We can't really evaluate fully
Hmm.
the whole person, right? I don't see you walk in, so I don't see if there's any issues with ambulatory, any extra fidgety stuff other than what I can see
Sure. Okay.
from the screen up. Some folks report difficulty in reading body language
All
and
right. Yep.
on the screen, that it's a little harder for them. I mean,
Hmm.
of course, technology problems, and if
Oh,
someone doesn't
yeah.
want to turn their camera on, it's very
Yeah.
difficult to assess someone's affect and presentation if you can't see them, and you can't
Hmm.
really do much of an assessment that way. I don't know what the insurance rationales are,
Right.
but those are some of the pitfalls that we've
Hmm.
found.
So during this transition to telehealth, so you have the format, have insurance companies changed their policies to uh, allow providers to obtain the same revenue?
Yes, that's what I've found so far, is that we've
Hmm.
been paid at the same rates as our regular sessions, with
Okay.
the caveat, of course, it has to be video and audio. But yes,
Okay.
Medicare led the way with that. Right around
Mm.
March, I think March 16th, that Monday, or
Hmm.
probably maybe the 13th, the week before, we were getting some word that Medicare was saying that they were going to pay for it. And as Medicare goes, most
Yeah.
of the other insurance companies go. And
Right.
so through the next couple of weeks, there was lots of questions and calls from our
Sure.
admin and billing departments to the
Hmm.
insurance companies, who finally all sort of fell in line and agreed for this period of time. There's
Yeah.
some practices we have to go through, some questions we have to ask patients to, be sure that they're on a secure line, and they
Hmm.
agree to the telehealth format, and that their sessions should be covered under the 1135. I think the waivers are called.
Hmm. So you said before you had, one patient you're seeing for a year for telemedicine. So how many patients do you now see in a telemedicine format?
My practice, until just recently, I had 4 counselors working for me, and I see patients myself.
Oh, wow.
So my 4 counselors see patients all day long, whereas I have faculty
Sure.
duties and meetings and things. So my counselors all see 25 to
Oh,
30
wow.
individual patients a week, plus we have a dialectical behavioral therapy program, which includes some group therapy. And so there's 2 groups
Mm-hmm.
that are there. So I would say we probably have, prior to the one counselor who left, she moved out of state during the
Mm-hmm.
pandemic, if you can imagine.
Oh, good.
Um,
Jeez.
Crazy. We were seeing probably 180 to 100 individuals a week across my team.
Whoa.
Yeah, and that's our normal.
Okay.
We're pretty close to normal. Again, so 4 counselors at 25 to
Okay.
30, depending, individuals a week.
Gotcha.
Times 4, it's 100. Yeah.
So you're doing the same amount of work now. It's just
Yes.
over telehealth. Okay, so that's
Yeah.
encouraging that you're able to make that switch right away.
Exactly. It was nearly seamless. It
Mm.
was really impressive. I called a meeting with my counselors on Friday the 13th. We got the admin who was with us. Every patient who walked into the clinic that day, we got them on telehealth. We
Wow.
got their my chart together. We told them what to do. The admin
Mm-hmm.
helped us. We got everything up and running.
Wow, that's
Made sure
great.
they had it before they left the clinic. Everybody in all their spare time called all their patients, got
Mm-hmm.
everybody that we could onto telehealth. And on Monday, the
Mm.
16th, we had everybody on telehealth
Got
completely, including
Wow.
groups, seamless without a hitch.
So that's awesome. So what has been the general response on 2 sides here? So for the patients of transitioning to telehealth, and then for your counselors that you oversee, like what's been their general response to switching?
Sure. Well, given the health concerns, being able to reduce in the office
Mm-hmm.
the number of people that were there to just workers, and then once we were approved to work off site, people are much more comfortable and feel safer.
Mm-hmm.
Not having to come into the clinic and being exposed to whoever's been
Oh, right.
exposed to whoever's been exposed to whoever's been exposed. So it's been really largely very positive. We only had maybe a handful of people who said, I'm not comfortable with video. I
Sure.
don't know how to work a computer or have
Mm-hmm.
access to the equipment that I need. Very few people. My particular team doesn't have a large geriatric population. We tend to
Mm-hmm.
see middle age. We have a few folks over the age of 60, but most people are younger.
Mm-hmm.
Uh, some adolescents. We don't have a lot of real young children. So we're sort of in that sweet spot between adolescents and probably 60.
Mm-hmm.
So most folks had access, and
Sure.
very positive responses. Our patients are telling us they feel much safer. It's more convenient for them. My practice is in Hale, so they don't
Okay.
have to leave their jobs and drive across town and
Right.
do
Yeah.
all the things. They can go to a private room or their car. Some have gone to the parking structure when they were still on campus.
Oh, sure.
People, largely really, really, really positive. People are
Sure.
feel safe. We don't have a lot of technology problems. Every once
Mm-hmm.
in a while, I'm sure your experience as well with Zoom. Every
Yeah.
once in a while, it gets a little glitchy,
Yeah.
but it's largely been way more positive than negative.
Mm-hmm. So you serve everybody in Alachua County, the Gainesville community.
In other counties.
Oh, other counties
We
too.
have,
Okay.
I have, especially because of the dialectical behavioral therapy program, that's a service, that's a specialized treatment that isn't really widely available still. And
Mm-hmm.
so I have patients, especially adolescent patients, whose families drive up from Ocala, sometimes from Lake City, High Springs, so sometimes Marion County, some of the other surrounding counties. With
Mm-hmm.
telehealth, with students being away, we have patients all over the state of Florida, obviously, right now.
Right.
So that's been a huge help, that some patients who may have gone home for the summer that are looking for therapy with our folks couldn't
Ah,
get
okay.
that in the summer normally because they've gone
Oh,
home
wow.
and telehealth
Yeah.
wasn't covered. But right now,
Mm-hmm.
so far, it's being covered. So we're able to service people in South Florida.
Oh, wow. That's interesting.
Yeah, it's very cool.
It's interesting how you're able to create new opportunities for therapy for individuals.
Hmm.
Compared to prior, telehealth wasn't a part of your model.
Hmm.
Um, do you foresee that as states begin to reopen and rules change and we try to get back to whatever the new normal is, do you see telemedicine then being a part of the clinical practice?
It already has been in the medical field. I know
Okay.
in medicine, many rural hospitals use physicians via telemedicine,
Mm-hmm.
where they don't have as many doctors. So they're on computers they have nurses and such that assist in the different rooms, and they see the patients over the computer screen. My
Mm-hmm.
hope would be, yes, that we could continue. I know that psychiatry has done some telehealth with
Mm-hmm.
folks. Prior to this, I don't know how
Right.
much coverage they were, how much payment, and all of those things, how successful that was. But that would be
Right.
my hope, yes, that
Mm-hmm.
it would be an ongoing option for patients. I think we
Right.
can service more people.
Yeah. Um, so now to think about our current stressors and anxiety related to the pandemic, you've been seeing 80 to 100 patients, over, year after year. And now we've gone through this transition, without giving out any specific information, or you don't want to break any HIPAA or anything, but is there any general things that you're noticing as far as, you have patients that you're already seeing for mental health services, and now we have this new pandemic that's layered on top of it. Is there anything new that you're starting to notice that people are struggling with, or areas that your counselors are really are able to support and help patients with?
Sure, of course. Lots of uncertainty with some
Mm-hmm.
folks who still have jobs and
Yeah.
who are working, have maybe had to suddenly shift to also working from home and being on
Mm-hmm.
a telehealth platform or Zoom platform for their various jobs.
Right.
Very anxious, loss of control, lots of uncertainty. That's stressful for
Yeah.
all of us. Healthcare workers that we see, you can imagine lots of stress. Those who are working closest to the most ill patients,
Mm-hmm.
struggling. I have a patient who's a telehealth physician who's
Mm-hmm.
done some work out of state, lots of stress with lack of support in rural areas and a loss of control, sort of feeling helpless. Those things. And with people who have lost their jobs, the stress of not being able to get unemployment and having the funding come through and what's going to happen next, how long is this going to last?
Yeah.
Yeah, it's a lot.
Sure. So you have like all, 20 items that are uncertain. But I think what's
Sure.
interesting is that your telehealth model, like that is certain, like you figured it out. So
Mhm.
maybe just by virtue of having consistent therapy, like maybe that in and of itself provides people with some type of, loosely speaking, I'm not the clinical health professional here, but like some type of structure and hope that like everything in the world is uncertain, but like I know I have my weekly session and that keeps
Mhm.
me going.
I think it's been helpful for folks to have some
Mm-hmm.
consistency. We've had some patients who hadn't been seen in a while who
Right.
came back. As you might imagine, of course, our college and psychiatry
Mm-hmm.
got the wellness program up and going through EAP. So there's healthcare workers can call into that and can
Right.
get 6 sessions free, and that's been a huge success. It's been a
Mm-hmm.
lot of tools and stuff that people are putting out with guided imagery and
Right.
resources that people can use, childcare, all of
Mm-hmm.
those things.
Yeah. So has there been maybe one or two things that you've kind of been surprised to learn through this process of transitioning from, you know, regular, clinical therapy to telehealth that maybe you hadn't anticipated?
I was really surprised that for my team, and my entire department followed behind me. I was instrumental in helping all of the Department of Clinical and Health Psychology, which is a huge department. We were all able to really quickly get online, so to speak. So
Mm-hmm.
neuropsychology, child and adolescent psychology,
Right.
assessments
Okay.
are all being done very fast. So I was most surprised by how quickly and
Mm-hmm.
how relatively seamless we were able to get a huge operation
Sure.
online and without missing much of a beat.
Mm.
I think that's the biggest thing that really surprised me. And kind of honestly, how few people, in terms of patients, were
Mm-hmm.
resistant and unhappy about it. Most people just really rolled with it and said, okay, there were some glitches, but most
Mm-hmm.
people were really receptive, really positive and happy about it. So that all kind of surprised
Sure.
me.
Yeah, I heard a kind of a similar story when talking to PhD students that work as contact tracers in epidemiology. That whenever they're calling people on the phone, that everybody's like very receptive and very
Great.
easygoing. Of like, yeah, this is a transition, and we're happy to help out. And it's just been encouraging now for me to interview different departments and different facets of this COVID-19 pandemic. That I think that's a theme that's emerging. That's everybody's very collective minded, so to speak. Everybody's kind of working together, which is very
Yes.
encouraging. So
Yes, there was definitely a lot of that. Multiple people from different areas, research folks, clinical folks in our department, really working together very quickly, putting policy together, written instructions together for students
hmm
and faculty, being available at all hours, just about in the beginning through the weekend to get people
hmm
up and running, and how really well it came together.
yeah, there's just a lot of, I think it's encouraging to hear all of the good news and the support and the wins, because we
Mhm.
hear we hear about all the losses on TV all the time. So
Uh-huh.
it's great to celebrate all the wins. So as we kind of look forward now to through the summer, right? The semester just ended. Um, there's there's a lot of uncertainty there. What do you anticipate being maybe a problem that we have to work through the transition, and maybe what's an opportunity for us to really work on?
So the transitions to bringing people back to campus, including faculty.
Oh, sure. Yeah, it could be specific to campus, or just maybe anything specific to any type of city transition, right? Everybody's going back to
Sure.
work, so.
Right. And navigating that,
hmm
a lot of
Right.
people are afraid. I won't say everybody because, I can't know that. But I hear a lot of fear. I hear a lot of people being not comfortable with going back to work, with wanting to
hmm
wait longer, with not being sure, with
Right.
thinking about Gainesville in particular, with a large student population who are scattered about, although a lot of
Sure.
students stayed here locally. Um, how do we make that work? How do we, the questions that you would think of, right? The testing,
Right.
and how do you keep testing going enough, and how do you be
hmm
for sure, and how do you keep everybody safe? Those are the biggest concerns that I hear and I see. Just the navigating, what are the new parameters? How do you,
hmm
for us, how do you do therapy in a space where you can't get 6 feet away from somebody?
hmm
How do we navigate our office space? How do we do
Right.
groups in a room that we can't? Are we going to,
hmm
a lot of those questions in the more immediate and the longer
Sure.
term, as you're hearing on the news, I'm hearing on the news, we don't know about a vaccine yet. We don't know,
Sure.
what is this going to look like? Is it going to be like the flu where it's different every year? And what does
Oh,
that
right. Yeah.
mean for our jobs, right?
hmm
Because this has been more deadly. What does that mean? What does
Yeah.
it mean for us? Are we wearing that? Are we ever going to be able to go see a baseball game again?
All
What does
right.
that mean?
Right.
Then what is the new normal, like you said?
Right. Yeah. It's I think the a conversation I've had with faculty within EGH is, we've all kind of people, this is just anecdotal. It's like we all kind of thought that the transition to home was going to be the hard part, but really the back end transition to work and everyday life, the new normal, like that's actually going to be the hard part, because we're kind of in this phase of, the first couple weeks of the pandemic and transitioning. We didn't know what was going to happen. And then now we've adjusted for the past 3 to 4 weeks. So we're
Mhm.
good. We got it figured out. But now, state officials, maybe university officials, local governments are telling us, oh, now it's okay to go back. Now we have to manage another 2 to 4 week transition. And then we have to get
Right.
to, smooth water. So there's still going to be, another, whenever a decision's made on that transition, there's still going to be another 6 to 8 weeks of finding homeostasis, or whatever you want to
Mhm.
call it.
Exactly.
So,
Exactly. And you think about long term with the healthcare workers, with the mental health care workers, with us. I mean,
hmm
I'm the probably likely much higher cases with PTSD of patients, depending on where people have worked and how they've
oh,
worked,
sure. Yeah.
the long term effects on the economy, and how that impacts local folks, and uh,
hmm
the school system, and the challenges with all of
Right.
that.
So, do you anticipate, this is just me kind of snowballing here, do you anticipate a particular bottleneck if we do see an increase in certain clinical diagnoses like PTSD for frontline workers who are seeing, death every day. Like, do you anticipate a particular bottleneck? And if so, like what do we do about it?
So what do you mean by a bottleneck?
So you only have 4 counselors, right?
Oh, okay.
So you can only see 100 patients a day. Like, is that the bottleneck, or can you see more? Like, do you have master students ready to go? Like, what do
Sure.
you see at your level of administration?
So sure, I'm correct. We have a regular caseload and pretty full already.
Okay, yeah.
Pretty full. Actually, but we have an entire department in Gainesville.
Mm-hmm.
Mental health can be challenging because it's a small town with a lot of people. For a small town with more people than it probably should have for the size of the town, if that makes sense.
Mm-hmm.
And for UF, there's the clinical and health psychology department, and there's the clinical psychology department at Spring Hill.
Mm-hmm.
And that's it for the number of, and the college of the counseling and wellness center, which primarily services the students.
Sure.
But for Shan's employees and UF employees and their families and their kids, it's us and them at Spring Hill. And for on campus, connected to the university. There are a lot of private practices and other organizations. There's always the Alachua County Crisis Center, who will see anyone at any time for any reason that's not a crisis. They have crisis lines that are open 24 hours a day. So when we're full, so my department, as I mentioned, is a training program. We train clinical psychologists. So we have a ton of students who are overseen by faculty who provide clinical services. So the clinic is a pretty huge operation. And so patients can be seen there. There's the EAP system as well that's been set up especially for healthcare workers. So the goal with that was to not have a bottleneck of like kind of what you're talking about, that someone could call, a healthcare worker specifically could call the EAP, have 6 sessions for free, not have to go through the insurance and all of that. And maybe that's all you need. If they need longer term treatment, we'll do what we can and get them in as soon as we can.
Yeah, a lot of moving parts, a lot of uncertainty. But I think we're all doing our best to get there. Well, Lisa, I think maybe we'll kind of close on this question as it relates to workplace well-being and connectedness, right? That's kind of the theme of these webinars. What do you see as maybe if you were to maybe give some advice to somebody watching, like what do you see as the most important thing to think about when it comes to general, obviously with your expertise, your clinical mental health and well-being? What would be a good strategy for people, during these times?
A few things. I think most importantly is making sure you adhere to a good sleep schedule, because sleep is so important across the board for us as humans. It's how we charge our batteries. It's how we restore. And when sleep goes down, everything goes down. We're much more vulnerable to stress and anxiety and depression, even situational when we're not getting good sleep. So the things that you've probably been hearing: good sleep, continue to exercise, even if it's just a walk around the block or walking up and down your stairs in your house, walking your dog, whatever it is. The exercise, we get out in the fresh air, get out in the sunshine, the good nutrition, those pieces. Making sure that you can set boundaries for yourself and with other people, that you take some time out for yourself to be able to engage in some self-care, be able to decompress, and to just know that it's okay. It's okay to be stressed, and it's okay to be unsure, and it's okay to be scared. That all of those things are okay.
Yeah.
Everybody else is all those things too.
Yeah, I like that. It's like I've heard somebody say, like, somebody else has had the same problem that you have and is going through it, or somebody's probably going through a worse situation. So I think it's great to hear that, like, yeah, we're all in this together, and it's okay to be stressed out. It's okay to be tired. Make sure you get your sleep, of course. But this is the world that we're in right now, and that's okay. Yeah. Well, thank you, Lisa. I appreciate it, and you have a great weekend and
thank you.
Great summer. Thank you.
Thanks for having me.
You're welcome.